So I want to thank you for what has been a really exciting day and a half. I think we've learned a lot. Please go ahead and sit. About the kinds of design of cities as well as disruptions that affect the health of urban populations. I think we've also seen how across the series of talks that we've had, there's been a lot of reinforcement of ideas that come into focus from different lenses of the speakers that we've heard from. So I'm really excited to have had all these conversations and to continue them forward. In our last 5 minutes, I want to have an opportunity to thank some of those who have made this such a special day. And so I think we've had opportunity to thank those who've been up on stage, but I also want to recognize those who really shaped the agenda and the speakers, so people who were involved in developing our agenda, including the folks at the Urban Health Collaborative who are on the steering committee. I'd like to invite you to stand up. Our doctoral students who have been bringing mics and keeping the event flowing well. Our timing folks. The core leads for our training, policy community engagement core, and our research and data core have been also instrumental in shaping this event. I think we've all been impressed by the smoothness of the AV, and we've had photography, we've had so many people, but the biggest thank you has to go to the wonderful staff who are standing in the back who have helped make the event run so smoothly. So we are always experimenting and trying to make this event better, and in that spirit, I hope you will fill out our evaluation. One of the things that we've been looking to revisit by moving it earlier in the day compared to previous sessions was our poster session, and we also had an opportunity to ask folks to be involved in evaluating the abstracts and evaluating the posters. And so we did have among our posters attention to which met criteria for significance and potential impact on the health of urban populations, as well as importance and innovation leading future directions for the field of urban health, and the clarity of presentation, because I think we've heard so much about what's important to communicate. So I want to recognize 3 posters that we found to be really exceptional. And the first one is, unfortunately, the presenter is not here, but that is Justin Feldman from NYU, and Ana Alonso has agreed to come and accept the award on his behalf. So his poster was on comparing health and social outcomes among U.S. peer cities using cluster analysis. The second award winner that we want to recognize is Eliza Ziegler and her team. Her poster was titled "Anything Could Happen: How Perceived HIV Risk Influences PrEP Initiation Among Women Who Inject Drugs in Philadelphia." Thank you. And finally, our own Matthew Giannetti, representing the Promise Neighborhood team. His poster is entitled "Improving Sampling Probability Definitions with Predictive Algorithms." And just in closing, I want to thank, of course, Dean Ana Diaz-Rue, who's director of the Urban Health Collaborative and has really helped to bring us all together. I think as we think about ways forward in the field that we are also committed to, I've heard such a range of ideas over these days, but it's really clear that a way forward is through connection. Connecting across cities, connecting rural to urban environments, connecting history to where we are going forward from here, and connecting to each other, because I think we really have a network within the room of people who can challenge each other and support each other as we move forward. So I want to end on that note with some optimism to counter some of the difficult messages that we've heard throughout the day and throughout yesterday as well. And I just look forward to hearing about great work that you do in the coming months. Thank you.